Alors bonjour à toutes et à tous.
Hello, everyone, and welcome to this press conference from the Premier of Quebec, Mr. François Legault, the Minister for Health and Social Services, Christian Dubé, and the National Director of Public Health of Quebec, Dr. Horacio Arruda. The Premier is going to say a few words, and after that, there will be a question period from journalists in both French and English. Mr. Premier. What a beautiful month of June in Quebec. It's nice, the Canadians are winning, and the situation continues improving. Today, 150 cases, new cases only. And vaccination is going very well. And you've probably seen that we are one of the best places in the world now for having given the first dose of the vaccine. So I think that we can be proud. And once again, I wish to thank Quebecers. It's thanks to you that we can be proud. And you're showing that great solidarity, and it has to continue. Of course, since things are going well, we are continuing with our end-of-lockdown plan. So as planned, on Friday of this week, the 11th of June, bars will be able to open their terraces. And as planned, on June next, the 14th of June, all of Quebec will be either in yellow or green. So we already had in yellow the Saguenay-Lac-Saint-Jean, Mauricie, and the east of Lower St. Lawrence. We're adding Montreal, the National Capital, Laval, the Montérégie, the Laurentians, Lanaudière, Eastern Townships, Outaouais, and the entire Lower St. Lawrence. So all those regions will be in yellow as of Monday. What does that mean? Well, it means that finally, as of Monday of next week, we'll be able to meet in people's homes. So people living in two different households will also be able to start again with team sports outside, and bars, as of Monday, will be able to open back up, including inside. The only region where we have worries yet is the Chaudière-Appalaches region. We've had long discussions. The cases have started decreasing, and we hope that that will continue. We are going to be following the situation for the rest of the week, but for the time being, we're saying that Chaudière-Appalaches should be yellow as of Monday next, but if the situation were to not improve, we'll leave it in orange. So it's important to continue with the efforts. That is the region where there's the most number of active cases per 100,000 people, so it continues being a little worrisome. Otherwise, as I was saying, all regions will be in yellow or in green. In green, we still have the Gaspésie, Île-de-la-Madeleine, Abitibi-Témiscamingue, Côte-Nord, and the northern area of Quebec. In green, what does that mean? It means meeting in people's households with occupants of 3 households. It also means team sports inside that can start again. So that is the hope that we have as well, of having that everywhere in Quebec within 2 weeks as planned in our plan. Something else that we announced with the heat. Public Health has accepted that children in schools not wear their mask in classrooms, but it's important to say that in common spaces and in school buses, the mask has to be worn still. Now, the big subject that we've been speaking about a lot in the past few weeks, proms for students. Well, first, I wish to say that we've heard you loud and clear, everyone. We've worked really hard, and we all remember, at least I remember, of my own prom at the end of high school. It took place at the Vaudreuil Inn, which unfortunately no longer exists today, which was in Dorion, and it had ended in the wee hours of the morning, and it was memorable. So I would like for young people to have that also as a memory. So what we are proposing is to say, okay, first, handing out the diplomas, that ceremony with the parents, that can be done as long as the distancing guidelines are respected. In schools, even outside of the regular hours. As far as the prom itself, the party itself, what we've agreed on with Public Health is to say most young people should have received at least 1 dose by the 24th of June. As we've often said, we need 2 weeks to have a full effect of the vaccine. So as of the 8th of July, there could be proms held outside. But, like real proms with big marquees, tents, as of the 8th of July. I'd like to end by saying vaccination. Our challenge for the upcoming months by August is really to convince everyone to go get their second dose. And I think Christian has said it. It doesn't hurt much, so don't be scared of getting vaccinated with your first dose and then the second dose. That is what will allow us to go even further by the end of August. English?
The situation continues to improve in Quebec. Vaccination is going very well. Our reopening plan is working and we can continue. This means that from next Friday, bar terraces will reopen. And starting next Monday, Montreal, Capitale-Nationale, Laval, Montérégie, Laurentides, Lanaudière, Estrie, Outaouais, and Bas-Saint-Laurent will turn yellow. The only region that still worries us is Chaudière-Appalaches. We hope the situation will continue to improve. Otherwise, we'll have to keep it in orange zone. But for now, the region is expected to turn yellow on Monday. Yesterday, we announced that students in orange zones won't have to wear the mask in classrooms because of the heat wave, but they'll have to wear it in common areas and buses. I also want to say a word on proms. I know how important it is for young people. I'm happy to announce that proms will be allowed outdoors from July 8th with a maximum of 250 people. Thank you. Donc, j'ai oublié de le dire aussi en français.
I forgot to say that in French, that the maximum is 250 people at those proms. We will now start the question period with Maxime Denis. Hello, gentlemen. Mr. Legault, I'd like to hear you on Justin Trudeau, who's saying that it wouldn't surprise him that over the following weeks or months, there is a thought process on Bill 21 in Quebec, because it's been a year that we have masked state services. What is your answer? Well, listen, I think that Quebecers know how to make a difference between a mask to protect oneself from a virus and a mask that is worn for religious reasons. We know that there's a vast majority of Quebecers who agree with Bill 21, who agree to forbid religious signs for people who are in a position of authority, and Mr. Trudeau should be aware of what the majority of Quebecers want. Mr. Arruda, on mask wearing in classrooms, I'd like to hear you on why that wasn't planned on Friday. Why did things have to be readjusted yesterday? Well, what was already planned is that wearing the mask was going to be removed in the yellow and green zones as such. And it also has to be understood that the measures for, the heat waves that are existing in the health network or elsewhere, a mask is uncomfortable, but that is not the element that brings about, heat strokes. In the present context, taking into account that classes are over very soon, it's been decided to remove it with the epidemiological information that we have as well. Concerning the proms, just a little clarification or clarifications, because you were talking about, people will be allowed to get closer, but I want to make sure that I understand. Will people have to wear a mask? Because there are rules on events outside, and do you presume that there will be changes in color zones by July, perhaps to the green zones in the calculation? What we've agreed on with public health is that we're doing a special. That means, let's be quite clear, young people will be able to dance together and be less than a meter away. So this is like a mask-free special event. And if you allow me, Mr. Premier, together with the ceremonies of handing out the diplomas with parents, we said at the beginning that it could only be held in school during opening hours, and the Premier said that it can be done over the weekend or in the evening. It could also be done in a rented room outside where people could while respecting family bubbles, to be seated during the ceremony. So just to let you know, if there are people who want to rent rooms, that will be possible. All right. Second question concerning the Moderna vaccination, because we're asking questions, but we don't get answers. So when and how many doses are we going to be receiving of the Moderna vaccine? And have you thought about the possibility of allowing people who received one dose of Moderna? Very often it's people with chronic illnesses who were vaccinated in pharmacies. So have you thought about allowing those people to get a second dose earlier on, but with Pfizer? I know a lot of people who got Moderna who'd be very happy to more quickly get their second dose if it was Pfizer, if Moderna is not available. Well, the answer is quite simple. It's just that as soon as we get the confirmation that we have additional volumes of Moderna vaccines, we'll say it. It could be already next week, but we don't yet have a confirmation. So what Daniel Paré was telling me just this morning is that it is possible, that is what the federal government is telling us right now, is that we could get Moderna vaccines in additional quantities next week, which would allow us to confirm a little bit as we've done with Pfizer last week, to be able to confirm that we can make sure that Moderna vaccines, the second dose, can be given ahead of time. But I'm saying for the time being, and I understand people who are looking forward to being able to get their second dose earlier for all sorts of reasons, but let's wait for next week, because we don't want to start, changing people's appointments without having a confirmation that the quantities will be there. But it should be as of next week, and we'll see one another pretty weak, so we'll be able to tell you. Now, on the interchangeability aspect, what we have to make sure of is that one of the reasons why we were able to accelerate the Pfizer vaccines is that we have additional amounts of the vaccine, but it doesn't change the number of people that we have to vaccinate. So, of course, our priority will be to those people who have already received a Pfizer as a first dose. And that is why, before answering anything on the interchangeability, yes, technically it's possible. For the time being, we prefer giving people who got Moderna as a first dose a second dose of Moderna as well, which we'll be able to confirm to you as of next week, as soon as we get our own confirmation. On the question of proms, clarification, Dr. Arruda, what makes it that we thought that it was too risky to have them before, and now all of a sudden we're saying we're making an exception? No masks? And there's no problem? What criteria is that? Is that just public opinion, or is it public health criteria? Well, first, the epidemiology compared to the moment that the decision was made is different today. It has accelerated in a significant way. And in that equation, there's also the question of the vaccination of young people. There's been a good response, so you'll understand that it was not the case before, and the proms will not take place before a certain period of time to allow the vaccine to get an effect with the first dose. And of course, we also listen to, patient partner, if you will. And I think that we can do it, taking into account the vaccination, taking into account the epidemiology that has been observed, the decreased numbers. We've just decided this. That doesn't mean that there's no risk. There's been parties with young people in the Saguenay, because we often say that things are not transmitted outside, but there have been cases, so it does remain a risk that will have to be managed. If somebody's not uncomfortable not wearing a mask, nothing prevents them from wearing it and then removing it for the picture. But in order to allow for a beautiful experience, taking into account the sacrifices that young people have made, to allow a more natural experience, we've accepted going there. I think that, and I've said it, in a pandemic, 3 or 4 days, 1 week, 2 weeks is an eternity. So we really are not at the same stage as what we were. We are in a much better place than what we're planning for. And our end of lockdown plan is going much more quickly. As of Monday, most places will be in yellow. So I think that this is very encouraging. Mr. Premier, you've probably heard of the position of the Great Chief of Akanis Tasaki concerning your reform project, the constitutional reforms that you want. The chief said that there will not be any reinforcement or change of the Constitution without the protection of Aboriginal languages. It's kind of a veto that they're doing. How do you react to that? To what was said? Well, listen, I don't know the details of the application of the Law 96, but for what I've understood is that they're already excluded. There shouldn't be any impact for them. Mr. Dubé, I would like to know, last week you said that there were about 220,000 people from 18 to 40 who still were to receive their first dose. Has that number changed since? Have you managed to convince more people? 25,000 less. We are now this morning, we're a little bit less than 195,000, slightly fewer. I would say that we are succeeding to convince about 5,000 per day. And in my book, if we go at that speed, we'll have reached the 75% in all age categories, even if it's a little bit lengthier than we thought by the end of June, beginning of July. So we wouldn't be very far from the original objective that we had, but we have to remember that we have almost 80% of the population of 12 and over with appointments. So it's only in that category that we are a little bit late, but generally speaking, we're already at 5% more than our objective. But we're following things. We are doing things. You've seen that there's vaccination clinics that we're doing right now, walk-ins. We've increased the hours. We had clinics that was a beautiful success here in Quebec over the weekend with the Vaccination bus. So we are continuing to do all sorts of things, making many efforts in, Montreal North. We have these kinds of ephemeral clinics more and more, but this is a public that we have to go reach in different ways, and we'll continue doing so. But I'm encouraged to see that we're winning over about 5,000 people per day in that age category. Last week, you also said that you were going to present to us a project of vaccination proof, but my understanding is that there's a great number of Quebecers who have not yet received a QR code. Is it problematic for those who got vaccinated, particularly in pharmacies? No, not at all. We're going to give you general numbers because I'll give you more details next week, because there's two steps. We're always talking about we vaccinated, if we just look at the numbers, 5.6 million people who have received a first dose up until now. We have information. We've already sent an offer of vaccination evidence for about 4 million people. So there are 4 million people who have received either an email or a text message. And the reason why there's a difference between the 4 million to whom we've sent it and the 5.6 million people who have been vaccinated, there's a series of reasons, but we're going prudently. Because if in our information, for example, that were collected either by our vaccination centers or by Clic Santé, or anyway, there's many players within that, if we don't get a confirmation that all three are working with the same person, we don't send out that confirmation, because we just want to make sure that we're not sending a confirmation request to somebody who doesn't have all three of those. So what we'll have to do as of next week, and that is why we're taking an extra week to do so, we're going to be setting up a portal where people will be able to go and confirm that the information that we have on them is the correct information and that they wish to receive the QR code. So if people have not received it, it's not because we don't have the information. We just want to make sure that the information that we have on them is complete in its integrity. So I find that it is a measure of prudence, but of course we will be able to do it as of a portal that will be put online next week. That's why we're delaying things by a week. To continue on this topic, the vaccination proof, Mr. Arruda, where are you at with your thought process? You have to give advice to the government. Where are you at? Is it thought about that perhaps establishments will be the ones to decide whether it's required or not? Well, we'll go step by step. First, I've told you that we have to finalize our portal, so I just want to make sure that it's the correct people that receive the right email or text message. That will be done next week. The second thing is, as you know, we make a difference between vaccination evidence and a vaccination passport. For the vaccination evidence, what I've asked Dr. Arruda, and I had a first project that I found satisfactory, but that we do have to refine a little, is that we'll say under what circumstances we could use vaccination evidence. And the first thing that jumps out at us is to be able to use it to travel, particularly outside of Canada. And that is why having vaccination evidence that is very concrete and to work on it to be able to make a vaccination passport with it. We're working very closely with the federal government. I think that even Mr. Trudeau made an announcement today saying that we were working on that. So I think that everybody recognizes that Quebec is ahead of time on this, going very well with the federal government. So I would tell you that I wouldn't be surprised, not that I want to give any date, because there's many things that have to be tweaked before then, but I think the Prime Minister also is talking about it, or the Premier rather is talking about it with the Prime Minister. But within a few weeks, I think that we could have a first app of our evidence, vaccination evidence in a vaccination passport for travel purposes, first thing. The second thing that you've asked Dr. Arruda to tell us, and I'll present that to you next week because we have things to work on, is that where are the other places, if there are any, where that could be used. So who could that be used for? I'll give you an example. An example which for me will encourage people quite a bit to get a second dose is that the vaccination evidence is only going to be really valid once we get the second dose, or what we call adequately vaccinated, because somebody who had COVID only needs one dose. So let's say somebody who is adequately vaccinated. That could have a very great advantage, for example, for a quarantine. Somebody who comes back from traveling, and instead of saying, well, we're forcing you to have a quarantine, if you can show that you have your vaccination evidence, well, we can get to people from public health and say, listen, I don't need to do a quarantine. That's a great advantage. So that is what we're refining with public health right now. But taking into account that we had the issue that I was talking to you earlier on, that of making sure that everybody will have received it, we decided to take a week more to do that. But of course, there are so many people. We only have 600,000 people with the second dose, so we have time to work on that over the next few weeks. But I would say that that is where we're at. So I understand that we're going probably toward a use of the vaccination passport in Quebec for the federal government, but more than just traveling outside. Well, there are advantages, like one that I just mentioned, somebody who, and it's always, in agreement with public health, saying what we have are health measures. Is there a health measure that could be put aside? Maybe that's not the right expression, but what we could compensate by the fact that somebody who's had 2 doses, in fact, does not need to do a quarantine. So it's the kind of discussion that we're having with them right now. Just an extra element to say that in the context of another wave, the fact of having a vaccination evidence or passport will probably change the kind of intervention that we'll be having, less isolation and all that. So these will all be elements taken into account. But our principles remain the same, that is to say, making sure that we have good quality of information and also making sure that we don't remove people's individual rights and freedoms. But if we had advantages, it would be benefits that we would call not major. We're not going to use a vaccination passport, for example, in a workplace or anything like that. To give access to work or education, because these are rights that people have and protected by the Charter, and I think that would be an exaggeration, but an adequate usage, well-balanced, that would perhaps allow, because of the fact that somebody is vaccinated with 2 doses, that they're not as much at risk, so less constraints as compared to another wave that could appear. So just a clarification, have you already transmitted your opinion to the government, or have you just summarized it? Well, this is not a literary review, but it's not what I wanted to say here. There are still things to be finalized, and I won't add anything more today. All right, Hugo Lavallée. On the same theme, Mr. Legault, we heard the Premier of Canada this morning talk about a scenario where, in fact, we would allow people who have received 2 doses of vaccination to work. It wasn't confirmed in that way, but we know very well that that is what they're going toward. On your own end, had you talked about the fact that you would have wished to wait for the end of August before the reopening of the border? In light of everything that we've heard in the past few minutes, does it seem to be an acceptable compromise to allow people who have had both doses to travel as of next week? Well, there's discussions taking place right now between the federal government and the provinces. So I would admit to you as well that I'm talking with Doc Ford from Ontario. Of course, the situation is more worrisome in certain provinces. The principle that public health wished to set up was to have 2 doses. 2 doses, we in Quebec, we are planning for it to be towards the end of August. That is why we could think of reopening the borders as of the end of August. But we might think that for the people who may have 2 doses, it could perhaps be in July. But that is part of the discussions. There is nothing conclusive for the time being. And another topic, I would like to hear, Mr. Dubé, because we heard this morning a little bit your intentions on the management of the ministry. Last week, the Auditor General said that there were important lacks in the medical payments, for example. Before going into, and this is without counting the pertinence that there were certain problems with it, but before going into a legislative reform, shouldn't we clean things up at the Ministry of Health itself? Wouldn't that be the priority? I think that both have to be done, to be very frank with you. The Premier realized it in the first wave. There are things to be done that have nothing to do with the legislative aspect, that are just good governance and having information, and I've said it. We're going from the facts to Excel spreadsheets, and now we have to leave Excel spreadsheets and have good systems. And we don't need the legislative aspect for that. We just need a good plan. But the law on health, when I'm saying that it's old, I'm not trying to be pejorative. It's just that the Health Act hasn't changed for a long time, and it is based on paper documents to protect people when the paper documents went from one establishment or one hospital to another. We're not in that world anymore. We're in a digital era. So what the pandemic has made us realize, and that is what I gave as an interview this week, I think that a combination of better governance, having access to better tools, we saw the good results that it gives us. During the pandemic, we saw this, to have good information to manage things correctly, whether it be for people who wanted to get screened, people who want to get vaccinated. We can see how they are well served through the sites. It's good for patients. But at the same time, it's good for managers as well, to be able to have information that can be exchanged when we have these meetings and as needed. And that is why before having a bill, I think that out of respect for my colleagues at the Assembly, we'll do what Eric did last week, a popular consultation over the summer before filing a bill on informational resources, which for me is the content of information. I will do the same thing over the summer because we learned a lot through the pandemic, quite a bit, and we can see what kind of information we had, and we can see all that. So over the summer, we're going to have this consultation. Once we get to the fall, as needed, after having discussed with the legislative agenda, we'll see what are our needs, what changes we need to bring to our laws. But at the same time, we can continue working because we have the possibility to do so. And for the Auditor General, well, that's exactly what she's saying. There's a lot of information, whether it be for the Institute of Pertinence. We ask a question, it takes 3 weeks before we get the answer. By the time we get the answer, the emergency is over. What we want is information in real time. That is what we need. We are managing between 45 and 50 billion per year. It's 1 billion per week. We don't have the means to wait for 3 weeks to be able to make a decision and to have the necessary information to make the decisions. My question is for Mr. Legault and Mr. Arruda. You talked about vaccination passport, you talked about vaccination evidence, you talked about opening the borders, perhaps a less difficult lockdown for people who have a second dose or isolation. But are you taking into account the Delta variant that is emerging everywhere in the world? So people will start traveling. Perhaps if there is a risk of increasing things we're talking about in July, it could be 40% of the public in the U.S. that will be hit, a lot more contagious, maybe not covered by the present vaccines. Aren't we going too quickly? We're taking those things into consideration because anyway, people who come from the outside will have to have tests before when they arrive here. And I would even say, on the 3rd and 7th day, and according to the vaccination status. So it's quite clear that the variant, which could come, the Indian variant or the Vietnamese variant or whichever, there's a new variant, and even a new variant in Quebec is still a threat. But we do have those surveillance mechanisms that are conducted, and I think that this is very pertinent, and we're doing it. On your aspect, the PCR test and the quick test, the Delta is not covered by that right now. Well, it's being developed in terms of characteristics. Those tests will be developed. And just to complete, what we're talking about for the time being is people who have had their 2 doses, because as far as I know, the vaccines do work with the Delta variant. So if somebody has received 2 doses, well, there is a certain level of safety. Yes, that's why it's so important to go get the second dose. Concerning masks, let's go back on the names that we heard in work. We're at about 46% of cases right now in Quebec, so we understand that it's decreasing quite a lot. Isn't it difficult to manage now? Wear the mask in the mall, but not at work. Wear the mask at the grocery store, but not at work. You know, at some point, there are doctors, amongst others, who are saying that it's starting to get complicated. The question is very pertinent, and I thank you for mentioning we are working right now to review these elements of different zones, you know, yellow, green, and those questions of masks, what will be mandatory and not mandatory, to bring some coherence to everything. Because you know that we're working with this SNES, but SNES takes care of workers, and after that, there's the clients. And throughout the next few days, we're going to be coming back with something that is simplified as far as wearing the mask is considered. So you don't agree with the SNES? No, at this stage, we are comfortable. But the further we go towards the second dose, the more we're going to have a high vaccination coverage, more these measures will be able to be left aside, particularly when the epidemiologically speaking, the caseload is decreasing. But right now, what we've talked about with this SNES, particularly in as far as the removal of the mask is concerned for professors and teachers, for example, we are comfortable with that. But I just want to say that taking into account that they're talking about the workers in public health, we want to make sure that things are coherent transversally in all sectors of activity, that it be coherent with the epidemiology, the vaccination coverage, and the color zone. As far as the border is concerned, Mr. Legault, you said perhaps end of July. We're talking here about Quebecers that might go elsewhere, but also welcoming travelers, because the tourist industry says that it's urgent to open the border. So it would be about letting people in who are vaccinated with their 2 doses. Well, first, the first objective is that we act safely. So for the time being, what I've said is we believe that the vast majority of people will have received 2 doses in Quebec as of the end of August. So to think that there are Quebecers who will be able to travel elsewhere and come back with their 2 doses, I think that this is something that we can take into account. So there are people who will have received both their doses in July. Is there a way of having of going through it all? What happens with people who are coming from foreign lands? Can we sort this? So that is why, unfortunately, I cannot give you a specific answer, because we're talking about that with the federal government as well. And on top of that, ideally, the federal government would wish to agree with each province. And for the time being, there are premiers who have different opinions. So all of that is being debated right now. I'd like to hear you on Chaudière-Appalaches, because I understand that now there's no question of a municipal. So what are the criteria you're keeping an eye on this week to know whether it's going to go to yellow or not? Well, the number of caseloads, the daily caseload. In certain parts of the territory, they have gone into yellow incidents, but much more recently than other territories, even Montreal and Laval. So it will depend on the epidemiology of how low the numbers are going, whether there are uncontrolled outbreaks, etc. But we have very good hopes that with what we're seeing, the downward trend, there was a certain delay compared to other regions, but we trust that they will be able to go into yellow. Yeah, we're talking about the entire territory. We're trying as much as possible to not, divide up the territories to, avoid intra-regional movements as well. We're really trying to maintain that. There will always be exceptions. There will always be things as such, but the trend is to keep an entire territory in the same zone.
Bonjour, messieurs. Petite précision peut-être avant ma première question, parce que ça fait...
And clarification before my first question, because I've received a lot of messages on the limit of 250 students for the proms. I understand that if there's more than 250 students in secondary 5, 2 proms will have to be organized? Technically, yes. Taking care of the fact that depending on how they're organized, to be done in separate zones with perhaps 2 marquee tents, but we don't want people we don't want there to be more than 250 people mixing. So yes. You also talked to us today about a situation that is encouraging measures, health measures that continue, lightening a plan that is going more quickly than planned. We seem to be on a trend of 150 cases per day. Might we have more specials like you're doing for the proms? Could we have them more regularly? Because I'm convinced that there are people at home who are thinking, we'd like to have a special too. So will those measures be lightened more quickly in certain places for certain opportunities? It has to be understood that already the plan, when we go from yellow to green, there are increases as such. I'll tell you, it will depend on the epidemiology. It's not because we have a plan that we have to follow it if something else can be done, because we understand people's needs. But I still want to say the virus is still present. There are still cases. There's still been deaths. More vulnerable people, unprotected people can still be ill, so we still have to go prudently. But all of that is being analyzed, I would say, regularly on a daily basis with our directors. And as I was saying earlier on as well, there's a new yellow, a new green, there's lightening for the health guidelines and different constraints that can be set up or removed. And also you were saying, we are at around 150. Let's not forget that now we're talking a lot about the numbers over the weekend. In the weekend, there's always a fewer number of tests, so we might be at 200, 250, or 300. That's more where we're at. We are on an average, if I'm not mistaken, for the past 7 days of 243. Concretely, the second dose. We've often heard about the second dose as being the passport towards freedom, to get back freedom. When we look at the end of lockdown plan, there's still measures left after the second dose. Now we're talking about a vaccination passport. Why is there still a hesitation to really reopen, to really end the lockdown once and for all and put the pandemic behind us? If everyone, or the objective of 75%, once it's done, why is there still that hesitation? Why are we remaining prudent? Well, first, because of the variant. Second, because we can see it even in England right now, with a good proportion of people with 2 doses, they have an increase in the number of cases. Well, thank goodness people are not as hospitalized and there's less, the death toll is not as high, but there's still the possibility of another wave, and we don't know how that is going to translate. As soon as we have the signals that the variants are under control, that the world epidemiology, because it can also be introduced from outside of our own world. So there's always that risk, and that is why we're going progressively. But we'll be amongst the first to be happy to tell you that we've come back to pre-COVID era if COVID disappears, while waiting for the next threat, because it won't be the last virus that will mutate and give us surprises. However, what I wish to say, I hope that the measures that we have set up, the health measures, will help to better control the flu, which also kills a lot of people every year. Thank you, Mr. Arruda. Mr. Dubé, Mr. Legault will now answer questions in English.
Good afternoon. I'm wondering, you have been saying for some time that even with the first dose after the 2 weeks, there's still a risk. So now when it comes to proms, they're going to be outside, but they're not going to be respecting the 2 meters social distancing. Have you, or do you have a mechanism of estimating what the risk is and anticipating what kind of outbreaks there could be?
First of all, it's important to understand that youth have a better response and immunology than older people. So probably after a first dose, if they wait 14 days or 3 weeks, they're going to be most fully protected, probably over 90%. So
spread it to someone else.
Yes, depending of which type of vaccine, we think that with the Pfizer that we give to them or Moderna, the transmission is lowered too, but that's not perfect, but that's the case. Second, they are not a high-risk population as others, comparing if there was elderly, BAL, with people more fragile that could have die from this. Third, there is a low level of epidemiology actually, and also the issue is that it will be difficult to say what exactly will be related to the BAL definition or the, what's the name exactly? I'm sorry, in English? Proms. And to others activities that are going to be happening before and after, you know. So based on that, based of the values, based of the importance for those people to have this special moment that happens only once in a life, the risk management we do. It's an outdoor also type of event, so I think the risks are well balanced with, I would say, the pleasure it will give and the memories for those kids.
On the subject of the second dose, we saw yesterday a lot of confusion around Clic Santé. There were some technical issues. We also saw these long lineups of people waiting at walk-ins. It was very hot out, and they were spending hours outside in these lineups. And some of them were even turned away because they got there and they said, no, you have to come back, whatever. People were confused, but they were also, it seemed like staff were confused. What exactly happened, and have all of those kinks been worked out?
Well, I'll divide your question in three components, okay? The first one is that next week I could have been clearer with regards to the second dose going to Pfizer. And the limitation, I thought I was clear, but I guess I was not, so I apologize for that. Because on the Moderna, we need to have confirmation that Moderna is available, and right now we cannot do that. So that I think has caused the confusion, and that will be clear hopefully next week when we receive additional Moderna. And there is no confusion for Astra, because we said clearly that we still have Astra. Astra, we're probably now into almost 100,000 that have been used. So, but we still have Astra for people that want their second dose. So the confusion was with Moderna, and again, we have cleared that, and this is the reason that when we heard about the confusion, we issued a communique, and we've been Daniel Paré has been very clear on that, and I think the confusion is clear. Now, to your point, into appointment without appointment. The issue is that we want to go and get this group of people that are between 18 and 30, and we know they prefer to go on without appointment. So we said, okay, let's go and add without appointment to all the region that we have. But in a day like yesterday when it's really hot, but you have the negative of no appointment, being that you have to be in line. So this morning, what we did, we talked to the PDG of each section, and we said, continue to open the no appointment, but make sure that when you can, that people can come inside with their coupon. Because, I mean, especially when we are vaccinating elderly people, we don't want the negative of people waiting outside when it's hot. So I think if you ask me, we've been vaccinated now 6 million doses. We learn every day. So my best answer to you, this was probably, we said yesterday was the beginning of the second campaign. I think we still have adjustment and will adjust as we did, but I gave you the three components of it.
Katsuni, CBC.
Good afternoon. For a Monday, people will be able in yellow zones to gather inside. But so if you are accelerating your reopening plan, but you're accelerating a bit more your reopening plan, but not your second dose. So what are you telling people? Because they have still to manage the risk. They don't have their second dose. What are you telling them to do inside?
In fact, the reason why we're going that way, it's because the epidemiology is good. You know, I'm not telling that the virus is not there. I'm telling that the virus is there, but it's not as frequent as it was before, so we can manage more relationship, more contacts. But if you're afraid, if you are a high-risk person, if you are an elderly person who had only received one dose, you can keep your distancing. You're not obliged to be with no distancing, with no mask on everything. I think it's a way of managing, I would say, the risk related to the epidemiology. So, but it's why I want to say that you should respect yourself. If somebody is afraid of getting it because he has not received his second dose, he's not obliged to do it. But if others want to do it, I think with the level of epidemiology that we have right now, we think we can go more to a normal life. We are not telling people to be 45 persons in a house or in a big party, but 3 bubbles that people that we know, we can manage the risk, which is, I think, something which is normal. Depending of the level where you're going to be, it's going to be well indicated in the websites of the ministry.
And Premier Legault, what are your discussions with Ontario, Premier of Ontario, for the reopening of the Ontario border? What are the possibilities at this point? Because the situation is getting better in Ontario. So what are your expectations with the reopening border of Ontario-Quebec?
But first, the discussion are confidential.
Yes, but what you can tell us, because it's been a while that
What I can tell you is what we are asking Quebec is about making sure people, they have their 2 doses. That's what we're asking. You can ask Doug other questions.
Good afternoon to the 3 of you. With regards to proms specifically, do you worry at all that this could set a certain precedence where people are saying, well, no mask, no distancing, 250 people? Is that a concern at all when you make this kind of decision, that perhaps maybe other events would want to implement these rules as well?
It's clear. Anytime we take a decision with one group, there is another group who is asking why them and not me. I'm sure that actually people about their marriage are perhaps telling, why should I not, there is a bal de finissant of 250, why could I not have the same thing? That's the risk we take. We take into account, I would say, the fact that you just can prom once. Actually, I'm not.
What about marriage?
Huh? Marriage?
What about marriage?
It seems that it could be more than once, and it seems that you can report it too. But we are always having those discussions and those tensions. It's clear, and there is always, when we take a decision, for some an impression of inequities. So that's it. In my case, I only married once. I hope that's going to be the case, because my accountant told me I don't have I could not divorce. It's going to be too expensive for me. Well, it's okay. But so that's real, and the problem is the comparisons and the impression that it's not fair.
Merci. Actually, the Premier took the question away from me. I was going to ask you about marriages specifically. But what is the difference between proms and weddings? Is it just that weddings are just too risky at this point because you're dealing with a wider age clientele? I mean, can you just explain that?
That's the case, and that's, I would say, I'm not telling that youth are not friends. But when you are in a marriage, there is more relationship in between persons and probabilities of more contacts, and that's one of the issues. The older groups, it's not only youths that are there. There is grandma, grandpa, grandaunt, granduncle. So, and this is the situation, and it's always have been the case that funerals and weddings are activities of high level, because there is a lot of emotion also, I would say, and between everybody at the same moment.
René Brumer, de Gazette.
Arruda, if I could start with just a precision. We said no more masks in classrooms because of the heat wave, but the heat wave is ending pretty much tomorrow, the next day, yet we're staying with no more masks in classrooms for the rest of the semester, correct?
It'd be the case for, I would say, the yellow and the green places. The only thing is that for grade 5 and 6, they must wear the mask when they are going to go in corridors or taking the bus, but not for the younger ones. They will not have to keep the masks.
Okay. We're announcing a lot of new liberties today, graduations with no masks in school classrooms, zone jaune. And we're also seeing things like mass celebrations every time the Habs win, which is good, but also worrisome. Are we not a little concerned with all these new liberties that we're allowing, that it could lead to an upsurge in cases?
There's always a concern. That's a question of risk management. But we ask people to do what we prescribe. If they do what we prescribe, and there is always exceptions, there is always emotions, there is always gatherings. At least when it's outside, it's less risky than inside. And I would say that probably the solution will be to respect the most activities out there outside than inside in this period. And we will follow up the data as we are seeing that going down. If it begins to get up, we will readjust.
Okay. And just on AstraZeneca, if I may, why is it that people who have had their first dose of AstraZeneca cannot now ask for a sooner dose of Pfizer if we have a lot of Pfizer?
Well, it's easy because the number of Pfizer that we have right now are reserved for people that are due for their second dose and the kids that are between 12 and 17. So we have enough vaccine for them. So our preference for now is to give people their Astra or their Moderna when we have them. And as I said earlier, for sake of Moderna, we should have confirmation next week. And Daniel Paré had said that we should receive also confirmation for AstraZeneca of additional doses. So the preference is, we're just asking, and I know I said that earlier, that people are waiting. They are anxious to move their second dose as well. But I think it's a matter of a week or two before we get the confirmation that we have those vaccines for them.
Merci. Monsieur le Premier ministre, la
Thank you,
Commission...
Mr. Premier. The Commissioner, Joanne Castonguay, is asking for 4 extra months to finish her final report on care offered in housing care for the elderly during the pandemic. What are you going to be answering to her? We will be accepting, because I think that it is important that the work be done correctly and that we have good recommendations and that we be able to set them up quickly. So we'll accept. Thank you. Inaudible question. Listen, we can't, get ahead of ourselves, but it looks good, but it won't be easy against Vegas or Colorado. So we'll be taking it one series at a time, but we're in a good mood. Things are going well. Both the young and the elderly are doing their part. Inaudible comment.
Okay, so... Okay, well, so we won 8 games. We need to win another 8 for the Stanley Cup. We'll discuss about the parade with Mr. Arruda if it happens, but I think we were, many of us, surprised to win against Winnipeg in 4 games, and I'm still expecting to see the tweet of Brian Pallister today, because we have a bet, so I hope he'll do like Doug Ford and get the jersey of the Habs.
Oui, puis d'ailleurs, la période des questions commence.
Yes, and the question period is starting, so thank you very much. Thank you.